From Montana's news leader, this is the MTN 9 o'clock news.
Good evening and thanks for joining us tonight. I'm Russ Riesinger. It has been 8.5 months since the first coronavirus case was confirmed here in Montana. Since that time, more than 64,000 people have been diagnosed with the virus and 739 Montanans have died. Well, the nation's top infectious disease doctor has been in the spotlight in that battle against COVID-19 more than anyone, Dr. Anthony Fauci. And tonight he talked one-on-one with Q2's Janelle Slade.
With concern about the coronavirus surge, the holiday season upon us, and today, the UK, the first country to approve the Pfizer COVID-19 vaccine with distribution to start next week. We want to go straight to the top to get some perspective. So today, Dr. Anthony Fauci, the country's top infectious disease specialist, joins us here on MTN. Dr. Fauci, thank you so much for your time.
Good to be with you.
Well, let's start with developing news today and your reaction to the announcement that the UK will start distributing the vaccine next week.
Well, that's fine. They did not scrutinize the data as carefully as our own FDA is doing. They're in the process of doing that now. It is very likely that vaccine will begin to be distributed in the United States. The first batch from Pfizer likely on the 10th or 11th of December, and for Moderna around the 18th of December. So the difference is really a matter of a week and a half, not much difference at all.
Here in Montana, tighter mandates are hotly debated. In fact, many Montanans, including some Republican state legislators, recently chose not to wear their masks inside the state capitol. What do you want to say to Montanans who are making this choice?
Yeah, I don't want to accuse them or in any manner or form be pejorative to them, but I would ask them and almost plead with them to look at the data. We have 267,000 deaths and close to 14 million infections in this country. That if you have a state like Montana, which doesn't have a lot, you have Billings, which has the major medical center there. You have about 25 ICU beds in that hospital. The last time we checked, you had more ICU patients than you had IC beds for them. That's a problem.
How quickly is this actually going to turn around?
Well, the vaccine is going to be given in incremental fashion to the various people in the different priority groups. By the time you get to the normal man and woman in the street in Billings or in anywhere in Hamilton, wherever you want to be, who's a 25, 30-year-old person who's otherwise healthy, that likely will be somewhere in April where they will have open access to the trial. And then by the time you get through April, May, June, you'll have most of the people vaccinated so that you could start looking at some sort of return to normality as we get through the summer and into the fall.
And Dr. Fauci says he plans to continue in his role at the National Institute of Health, and he expects to play a role in President-elect Biden's coronavirus task force. Back to you, Russ.
All right, thank you, Janelle. And you can hear today's full interview on our website, ktvq.com, or with the Q2 streaming app. Come February, Dr. Fauci is slated to speak in Missoula. The University of Montana's Mike and Maureen Mansfield Foundation sponsors the annual lecture. Dr. Fauci will talk about the coronavirus, the challenges of distributing vaccine, lessons we've learned so far, and what the new normal will look like in the future. That lecture is set for Wednesday, February 17th at noon. It will be held via Zoom. On the COVID-19 front, the state reported nearly 1,100 new cases this morning. And Montana's death toll now stands at 741 after 8 new deaths today. Yellowstone County and Gallatin County saw the most new cases today at 147 each, while Lewis and Clark County saw 137 new cases. Yellowstone County now has more than 4,700 active cases, while the state is approaching 65,000 total cases. During a news conference today, Governor Steve Bullock announced the state of Montana could receive its first round of COVID-19 vaccine doses in just a few weeks. MTN's John Riley reports from the state capitol.
The federal government has informed Governor Bullock initial shipments of the COVID-19 vaccine could arrive in the state as early as December 15th or 16th.
While we don't know the exact number, we expect or have been told about 9,750 doses of the Pfizer vaccine. And then we'll likely to be receiving several thousand more doses in subsequent weeks.
The state's first allotment will focus on vaccinating healthcare workers, of which there are more than 40,000 in the state. The Pfizer vaccine requires 2 doses that need to be administered 3 weeks apart to be fully effective. Bullock says realistically, it will still be many months before a vaccine is widely available for the general population. The state just saw its deadliest month for the virus and stresses the importance of wearing a mask and limiting contact with people outside your home where possible.
This is the reality that we must continue to live with until there's a widely distributed vaccine. That time will come, but until then, Montanans need to stay true to our neighborly spirit of looking out for others in challenging times.
At the press conference, Bullock also laid out how all of Montana's $1.25 billion in CARES Act funding will be spent by the end of the year deadline. $833 million went to more than a dozen grant programs, with business stabilization being the highest in need. $200 million went to local governments, and $417 million went to non-grant programs like COVID testing and National Guard response. Governor Bullock also once again called on Congress to pass additional CARES Act funding, noting that Montanans and Montana businesses desperately need it. Reporting in Helena, John Riley, MTN News.
In Billings, construction crews are clearing up what's left of the grandstands at Metro Park. The question for county commissioners now, what will go in their place? Q2's Mitch Legge shows us some of the options.
Last month, crews demolished the grandstands at Metro Park in Billings, marking the end of an era for the venue operated by Yellowstone County. Now, county commissioners are narrowing down the options of what's going to replace the former structure. Billings School District 2 officials were hoping for a multi-use sports facility, but now it seems that isn't in the cards for construction. Billings School Superintendent Greg Upham broke the news to trustees at a planning committee school board meeting on Tuesday. He received a letter signed by the 3 county commissioners saying they had no desire to continue the partnership with the school district, which had previously been involved in the conversations about Metro Park construction. The commissioners instead are focusing more on agriculture and entertainment in their planning. The school board chair requested Upham schedule a face-to-face meeting with the commissioners to hear about their reasoning behind the decision.
To find out what the rationale was for the decision, what input they gathered to make that type of a decision. I think that School District 2 is an immediate revenue stream for building up the Metro Park. And I'd like to have that conversation with them as well.
New construction at Metro Park could include an enclosed arena or another grandstand, depending on the county commissioner's decision. In Billings, Mitch Legge, MTN News.
Thanks, Mitch. And he tells us there are a host of other improvements that are planned for Metro Park, regardless of which master plan is chosen. To learn more, you can head to ktvq.com and search Metro Park Master Plan. As of this afternoon, MSUB still working to determine the source of the campus water leak that has affected 5 campus buildings. McMullen Hall, the PE building, Sissel Hall, Rimrock Hall, and the Student Union building all remain without water until further notice. The showers and restrooms in those buildings are currently out of use. Porta potties remain in place, and bottled water is available at all of the affected areas. As has been the case the last 2 days, employees who work at those buildings are asked to work from home tomorrow, if possible. Well, the lead in school drinking water reduction rule went into effect just under a year ago, and its goal is pretty straightforward: limit kids' exposure to lead at school. But for schools across the state, following that could be a challenge. MTN's Marianne Davidson has more.
It's as clear as this water. A refreshing sip shouldn't come with a side of lead, and a statewide rule is aimed at making sure that's the case at schools across Montana.
Children spend a large part of their childhood in schools and are more susceptible to lead exposure than adults.
The Montana Department of Public Health and Human Services, with the help of the State Department of Environmental Quality and the Office of Public Instruction, rolled out the lead reduction in school drinking water rule at the beginning of this year. All schools under the OPI have to test water from every fixture students could possibly get a drink from, and that can be a lot of fixtures.
Especially in elementary schools where you have a sink that you could possibly get drinking water from and a drinking fountain. So you could have, conceivably 2 fixtures for every classroom, plus your restrooms, plus your kitchens.
Fixtures have to come back with less than 5 parts per billion of lead to be usable. But getting to that usable level
it's challenging, to say the least.
So far, Kalispell is one of the only districts that have submitted lead results. And all of the 5 schools sampled so far have fixtures with elevated levels of lead. Just take a look at Elrod Elementary School. Of the 57 fixtures sampled, 43 exceeded the state action level of lead content. Water from 16 fixtures tested in the state-designated highest category, meaning those fixtures must be replaced immediately.
We have drinking fountains in our hallways that are completely, water is completely disconnected. They're, not just shut off, but like cut the line to the water.
And that could be the case at schools across the state.
We are expecting to see probably higher lead concentrations in the older buildings, and less so in some of the newer schools.
Lead can seep into water from plumbing and fixtures, especially older plumbing and fixtures. And here in Montana, we have a lot of older schools. According to the American Society of Civil Engineers, the average age of a school facility in Montana is 53 years old.
At the end of the day, the districts are going to be liable to go in and replace fixtures, redo plumbing.
That won't be cheap. Right now, Kalispell Public Schools installed filters on fixtures that showed elevated levels of lead. They work, but at $50 a pop, not counting the cost of replacements, they aren't a long-term solution. What is a long-term solution? New plumbing and fixtures. The OPI and DEQ have a remediation grant program that provides up to $1,000 per school. But Hill says work that needs to be done across the district could cost millions. It's a high price to pay, but to Hill, the choice is clear.
We owe it to our kids to make sure that we're providing the best possible infrastructure for them to be able to learn and grow.
In Helena, Marion Davidson, MTN News.
According to state records, only 8 schools have submitted lead samples so far. Schools need to test their water by December 31st of 2021. Still to come on the MTN 9 o'clock news here on the CW, we're going to hear what Montana's congressional delegation has to say about President Trump's refusal to concede. But first, a warm-up is in sight. Bob will tell us what to expect coming up after the break.